Hello everyone, this is Dr. CJ Tank and today we will discuss introduction portion in the colloidal dispersion in the subject Physical Pharmaceutics 2. Colloids. Colloids, they are derived by the scientist Thomas Graham in 1861. These are the glue-like substance in which the dispersed particle, we can say, which are also known as a internal phase, they are distributed uniformly in a dispersion medium. Dispersion medium, which is also known as a external phase or the continuous phase. Here the colloidal system is a states of matter which includes the ranges of particle size from solution to the suspension. That means we can say from very small size to the large size particle. We can say this one colloids is also a polyphasic system which has the size in between 10 to 100 angstrom up to the few micron. As the phase they are more than one, that means they are also known as a polyphasic system. In this pictorial view, we can see the homogeneous phase or the true solution, heterogeneous phase, that means the colloidal dispersion, and heterogeneous phase, coarse dispersion. The homogeneous phase or the true solution, which has the size range that is less than 0.01 micrometer. The example for this are urea, sucrose, oxygen gas and ions. On condensation, the homogeneous phase can be converted into the heterogeneous phase of colloidal dispersion, which has the particle size in between 0.5 to 1 micrometer. The example for this colloidal dispersion, they are acacia, albumin, insulin and silver solution. On flocculation and aggregation, this colloidal dispersion can be converted to the coarse dispersion, which includes two different phases. One of that is the dispersed phase and another one is the dispersion medium. The particle size, it ranges in between 10 to 100 micrometer. The example for this that is calamine suspension, magnesium oxide and RBC. Then application of colloids. Colloidal dispersion, they can be act in a different therapy as they have the better therapeutic action. So that's why they can be used in the treatment of different disease. For example, silver can be act as a germicidal, copper is used as an anti-cancer and mercury can be used in an anti-syphilis treatment. Some of the therapeutic agents, they are delivered in the form of colloidal dispersion and they can be given by the convenient route or convenient route of administration. They can be given by the oral route as well as by the parenteral route. Then next application, that is the absorption and toxicity. Colloidal sulfur preparation, due to the less size of sulfur colloidal preparation, the absorption of such a product that is very higher, and due to that there might be the chances of the toxicity as well. Then solubility. If we converting any solution, if we add any colloidal dispersion into the solution, by that we can improve the solubility. Here we can use the surface active agent and we can add into the solution. By surface active agent, solubility of sulfonamides and phenobarbital that can be increased. Then stability. We can use the dispersion of surface active agent to improve the stability of any liquid dosage forms, and also on the solid it can act as a coating, especially in case of tablet and granules. If we are using the colloidal suspension of gelatin or the colloidal suspension of hydroxypropyl methyl cellulose, they can act as a coating and which can protect the medicament from the adverse environmental effect. This colloidal system, they are also used for the pharmaceutical excipients, vehicle, carrier and product components. Then targeting of drug to the specific organ. Liposome, neosome, nanoparticles and microemulsion are such products which can be used for the targeting of drug to the specific body organs, where the tablet and capsule, they are not good or they cannot give the result for the targeting. We can use the such kind of different product like liposome, neosome, nanoparticles and microemulsion, which have very low size, or we can say the colloidal dispersion, and that's why they can target to the specific body organ. Some of the official parental product of colloidal dispersion: iron dextran injection BP, that is the which contains the dextran with the ferric ion, which can be used in the treatment of anemia. It is an example of the non-ionic hydrophilic solution. Then iron sorbitol injection BP, which contains the sorbitol, dextran, citric acid complexes with the ferric acid. It is helpful, or we can give this is via intramuscular route. So these are all about the application of colloidal dispersion. Then distinguishing features of molecular and colloidal dispersion. On the basis of some of the property, we can distinguish molecular dispersion and colloidal dispersion. First one, size of the particle. Molecular dispersion, it has the size of less than 1 nanometer, whereas colloidal dispersion, the size that is in between 0.5 micrometer to 1 nanometer. On the basis of visibility, we can say molecular dispersion, they are not visible with an electron microscope because the particle size that is very less, whereas colloidal dispersion, they are visible with the ultra microscope and also in electron microscope. If we consider the scattering of light, then due to the low size of molecular dispersion, they cannot scatter the light, whereas colloidal dispersion, they scatter the light and also they shows the Tyndall effect. Then transport across the semi-permeable membrane. Molecular dispersion, they are permeable through semi-permeable membrane, whereas colloidal dispersion, again we can say due to the higher size of, they are impermeable in nature. Settling. Molecular dispersion, they not settle on ultracentrifugation, whereas colloidal dispersion, it will easily settles on ultracentrifugation. Then if we consider the diffusion rate, then molecular dispersion, it has the or we can say the rapid rate of diffusion, whereas the colloidal dispersion, it has slow rate of diffusion across the cell membrane. So these are about the distinguishing features of molecular and colloidal dispersion. So in this video we have discussed about the introduction, application and distinguishing features of molecular and colloidal dispersion. Thank you for watching this video.